This session brought to you by an unrestricted education grant from Coloplast.
Thank you for joining us for Intermittent Catheters, Your Choice. My name is Steve Betker. I am the Reimbursement Specialist for Coloplast Corporation. The presentation will provide you, intermittent catheter users and caregivers, information on how to ensure you get the catheter you choose. The information we will share with you is general in nature and is not intended to take the place of advice you may receive from a clinician. We would like to take a moment to differentiate the types of companies you may encounter as you investigate the different intermittent catheter options available to you. There are several companies who manufacture catheters. As you can see from the list, there are names you may be familiar with, such as Coloplast, Hollister, Rochester, and Bard. Manufacturers are responsible for listening to users and clinicians and bringing products to the market that meet their needs. While most manufacturers do not sell directly to patients, they are the ones ensuring patients have new and innovative solutions to their catheter problems. Dealer partners are the companies which provide your catheters. Companies such as National Rehab, 180 Medical, Edge Park, and many others. Dealers are responsible for making sure you receive your catheters in a timely fashion, and they will often submit claims to your insurance on your behalf. There are presently 12 manufacturers who make intermittent catheters. Each has taken their own spin on solving patient needs. Some have been around for a long time, such as Coloplast, which was the first company to bring disposable intermittent catheters to the market back in the 1970s under the Mentor name. Sometimes finding the right catheter can be difficult. You may determine the right catheter for your needs only to encounter other problems or situations you don't fully understand. These may include things such as being told your insurance doesn't cover the catheter you chose, or receiving a catheter other than the one you expected. Another issue you may have faced is being told that the only way you are going to get the catheter of choice is to receive collection and insertion supplies, including things like gloves, wipes, and a collection bag. Some suppliers may also blend your order with some of your preferred catheters and some of a different catheter. You may also have received a larger bill than you expected, or you may have been asked to pay for your catheters up front. These are just some of the issues the following slides will provide some insight to, and should hopefully empower you to be informed on how to ask the right questions to ensure you are getting the right catheter for your needs. It is my pleasure to introduce Sharon Osgood, clinical consultant with Coloplast, who will walk us through selecting the right catheter for your needs. I will be back later to discuss the billing and reimbursement issues you may be facing.
What we would like to do today is give you something to think about when you are choosing or using a catheter. We want to talk about why hydrophilic catheters are fast becoming the standard of care in intermittent catheterization. We want to help you to understand what the prescription paperwork requires and the different categories for intermittent catheters. Let's take a look at the typical flow of a catheter prescription. The first step is selecting the right catheter that best suits your clinical and lifestyle needs. Which catheter is the best one for you? Changes over time can occur that impact how the catheter you use today may not be the right one for you at a later time. Changes in dexterity could make the catheter more difficult to handle, so maybe a pre-lubricated hydrophilic ready-to-use catheter may be helpful. Inserting the catheter may become difficult or even painful due to different conditions, so perhaps a curved coude tip catheter is needed. Perhaps you have had multiple urinary tract infections, or your mobility might have changed. A closed system may be indicated for you. The main thing to remember is that when something changes and you have any issues doing your intermittent catheterization, check with your clinician. Find out what the issue is and what options may be available for you. What are hydrophilic catheters and why were they developed? The hydrophilic intermittent catheter has an outer layer of a special coating which becomes smooth when wet. The lubrication that coats the length of the catheter was designed to minimize or even eliminate the friction force you get with inserting and withdrawing the catheter. The reason this is important is because friction force in the urethra can cause scraping, scarring, and tissue tears over time, and can lead to problems such as narrowing of the urethra or urinary tract infections. So, using hydrophilic coated catheters may help minimize the risk of complications because they reduce friction on insertion and withdrawal of the catheter. They minimize the risk of urethral trauma. They prevent catheters from sticking to the mucosa of the urethra, and makes it easier and more comfortable to do your catheterization, and overall may help improve compliance to your catheter program. Convenience of your catheterization program is very important. A package that is easy to open, something that is quiet to open and use, or a catheter that is easy to hold and easy to insert, less friction in and out. And how about fewer steps to catheterize, product that is easy and discreet to carry around, and catheters that you don't have to wash and reuse. The design of the catheter is important, and manufacturers are making every attempt to design products to address these needs. Catheters that are more convenient and easy to use may result in better long-term compliance. Once you and your clinician have selected the catheter, the physician writes a prescription. You would think that writing the prescription would be the easiest part of the process, but if the prescription does not contain all the information needed, you may not get the catheters you thought you were getting. If it matters to you which catheter you are using, then it needs to be asked for by name on the prescription and include no substitution or the dispense as written language required by your state. Keep in mind, you should not be charged extra for brand name products. Talk to your supplier and ask them if they carry your products of choice. Make sure they explain if and when the specified brand would not be sent to you. Make sure they let you know if it's not covered, because that is not always accurate. Suppliers need to be held accountable to their actions. Many manufacturers also have some type of discharge program. These may be nurse-led teams of specialists, and they can help you through the hurdles of getting supplies, finding out about new products, and even finding a dealer if you don't already have one. Once you have the signed prescription, it goes to the dealer. Now, dealers are great at two things: shipping products to patients and submitting claims to the patient's insurance plan. The dealer files insurance claims and files documents. With that in mind, what does the dealer need to ship product to you? They need the prescription, they need to keep chart notes in their files, and they need to make sure that prescription is renewed yearly. So if you prefer a specific brand, tell your supplier, and be sure to tell your clinician or physician if you are not getting the catheter you want. Once the dealer has the prescription on hand, they will ship product to you. Remember, if the clinician did not specify the brand and type of catheter and the exact quantity you should receive, the dealer can choose which catheter and how many they ship to you. This could mean that even though you may only need 120 catheters for the month, you could receive 200 catheters. Or someone who only needs a straight catheter may receive a closed system. Which catheter type the patient receives can have a profound impact on cost and ultimately on how much you will have to pay out of pocket. When the dealer ships the product and it arrives at your home, you may not always be aware of other options out there. You may assume that the catheter you received may be the only or best option for you. So, who should be the person with the most influence on catheter information and catheter choice? You and your clinician. Your clinician has a unique opportunity to make sure you are aware of options available to you, all to make sure you are using the catheter that best meets your needs, or as your needs change, find a different catheter option that may be best for you. If your dealer sends you a catheter you do not want, contact that dealer to ask for the catheter that you do want. Take one of your catheters with you to your next doctor visit if it's coming up soon, or call your doctor's office to tell them you got a different catheter than the one you wanted. Be your own best advocate.
Billing in the United States insurance system is very complex, requiring a lot of expertise for each insurance type. Few suppliers will take all insurances. Different suppliers tend to specialize in certain insurances. Be sure to ask your prospective supplier if they take your insurance and they are in-network if it's a private insurance, or if they accept assignment under Medicare. Assignment is a term used by CMS, the Centers for Medicare and Medicaid Services, and adopted by other insurances. It means that the supplier will file a claim to the insurance directly and bill the individual only for the copay, for example 20% under Medicare, of the set reimbursed amount, for example roughly $1.80 for straight catheters under Medicare. This is an advantage for the catheter user since they only pay copay and not the entire bill when ordering their supplies. They don't have to file the insurance claim on their own, and they won't face additional out-of-pocket costs. Without assignment, the supplier may charge the individual a higher price than the set reimbursement amount. How do you ensure you are getting the catheter you choose? Open communication with your dealer and asking some very direct questions will help make sure your dealer is the best fit for your situation. Their network status with your insurance plan or their willingness to accept assignment if you have Medicare will have a direct impact on your out-of-pocket costs. In most situations, there are multiple dealers who are in-network with your private insurance or Medicaid plan or will accept assignment for your preferred catheter through Medicare. Not every dealer is the same. Some are very adept at navigating the tangled web of reimbursement challenges that your insurance plan may present. Others may not be as skilled. Choosing the right dealer may mean the difference between getting the product you choose or having to settle for a lesser product, or possibly even not getting your catheters covered. Coloplast works with virtually every catheter dealer in the United States, either directly or through a distributor. If your dealer notifies you that a new prescription is needed, be sure to contact your doctor's office. Most dealers will send a request for you, but in case they don't, contacting the doctor will help ensure your prescription gets completed and filled in a timely fashion. Also, understanding the benefits you have under your plan can help save you some headaches and hassles. The next several slides will provide you with the information you need to be able to contact your insurance and ask the right questions to know as much as you can about what products are available under your policy. Many clinicians and even more catheter users may not be aware that in April of 2008, Medicare changed its policy to allow one intermittent catheter per catheterization event, up to 200 catheters per month. This was prompted by ongoing initiatives that involve various state Medicaid programs and the VA. This change is in line with FDA labeling for intermittent catheters, which indicates they are a single-use product. Reimbursement categories define how products are brought to market in the United States. The Healthcare Common Procedure Coding System is a universal system of codes used to describe goods and services provided to patients. There are both Level 1 codes, also known as CPTs, which are used to describe the services provided in office, so think of these codes as the activities involved in patient care like surgery or an office visit. These codes are 5 digits and are completely numeric. There are also Level 2 codes, which are more commonly referred to as HCPCS, which are used for the stuff used by providers and patients. These will include intermittent catheters, wheelchairs, implants, TENS units, and many others. HCPCS are what we'll talk about today. The language of these codes is defined by CMS, Centers for Medicare and Medicaid Services, and verified by a government contractor, the Pricing, Data Analysis, and Coding Body called PDAC. One point that is important is that the HCPCS coding is consistent across all payers, Medicare, Medicaid, and private. This was not always the case, but thankfully we now speak the same language, regardless of who your insurance carrier is. Coverage levels and limits, however, can and will vary from one payer to the next. When we consider intermittent catheters, it is important to note that there are only 3 HCPCS codes that apply: A4351, straight-tip catheters with or without coding; A4352, coude or curved-tip catheters with or without coding; and A4353, sterile kits or closed systems. It is important to note that for both straight-tipped and coude catheters, the code language specifies with or without coding. Thus, an innovative hydrophilic catheter will bill under the same code as an uncoded red rubber catheter. Because there are not currently separate codes for coded or innovative catheters, quality can vary greatly within the code categories. As you can see, products such as Coloplast SpeediCath, Bard CleanCath, Cure Catheter Straight Tip, and Straight Red Rubber catheters all bill under the same code. When we look at the A4352 code, we find a bevy of different coude or curved tip catheters, including the Coloplast SelfCath coude and SpeediCath coude, Hollister Apogee coude, Ruche EasyCath coude, and Red Rubber coude. In the A4353 category, here again we find the closed systems and sterile sets in the marketplace, with several different product offerings from multiple manufacturers. I'm going to restate this point because it's a key one. Each of the items you see listed in these categories will be billed under the codes listed above. When the claims are filed, it is the code billed that is reimbursed. Brand name or product name does not matter. Private insurance carriers, Medicare, and almost all Medicaid plans do not distinguish between a hydrophilic coated catheter or one that is uncoded. The exceptions to this rule are Texas and California Medicaid programs, both of which do have a separate, higher rate for hydrophilic catheters than they do for uncoded catheters. Outside of these 2 exceptions, there is no consideration for innovation from a reimbursement standpoint. Products are placed in the appropriate code category based on the criteria spelled out in the definition of the code. As such, because reimbursement is determined by code, all products under A4351 are reimbursed the same. All A4352 products are reimbursed the same, and so on. To overstate it for dramatic effect, red rubber catheters are reimbursed the same amount as innovative hydrophilic coated catheters. Except for one thing. You need to purchase a packet of lubricant to use the red rubber catheter. These are also covered by your insurance plan, but at an additional cost. There is no differentiation. The insurance carrier recognizes the code, not the brand or the type. Dealers will pay different amounts to acquire and resell each different catheter, so there will be motivation to encourage patients to use a lower cost option to help preserve profitability for the dealer. This may also limit access to certain products for some patients. As we discussed in the previous slide, since both hydrophilic catheters and uncoated catheters are reimbursed under the same HCPCS code, there is no difference between them from an out-of-pocket standpoint. Your coverage and expense for these products would be the same, so long as you utilize a dealer partner who accepts assignment for your Medicare plan, or, if you have Medicaid or private insurance, is in network with your plan. If you use a dealer who is out of network or does not accept assignment, your out-of-pocket costs will be affected by how much the dealer charges for the catheter and not necessarily based on the price your insurance company sets for the code the catheter is classified under. It is important to know that each insurance, Medicare and Medicaid plan, will have its own allowed amount, and this can have an impact on which catheters you can receive. Though all are reimbursed the same, some plans do reimburse so poorly that access can be restricted to certain products. What else can you do to make sure you are getting the right catheter? Be your own advocate. The presentation you saw today focused on several key issues you may face in both selecting the right catheter and making sure you can get access to that catheter. Consider how well your current catheter is working. There may be options available today that weren't available when you started cathing. They may work better for you by providing a faster drain, or perhaps they are more comfortable than your current catheter. Perhaps your condition has evolved over time. Discuss these changes with your clinician. They're there to help you and may be aware of some of the options as well. Check out manufacturer websites and events such as Abilities Expos or Spina Bifida Education Days. There are many events focused on people facing similar challenges to yours, and at many of these events, there may be opportunities to get product samples and information. Many manufacturers will have programs you can work with which can get you samples of their new products. Perhaps one of these products can be more comfortable or easier to use.